Alrighty, hello everybody, my name is Brandon Diaz and I'm going to be going over vitamin D supplementation and type 2 diabetes. Okay, I'm going to outline what is vitamin D. So vitamin D is a fat-soluble vitamin that has various roles in bone health, immune function, and insulin sensitivity. It can be acquired through the sun, diet, or supplementation. Vitamin D2 or ergocalciferol is less effective than vitamin D3 at maintaining vitamin D blood levels, and it's mostly found in plant-based foods. Vitamin D3 cholecalciferol is usually made in the skin due to the sunlight, and 1,25-dihydroxyvitamin D is the active form. So deficiency in children can cause rickets, and in adults it can cause osteomalacia. Toxicity can include hypercalcemia or hypercalciuria. And here I have a picture showing different food sources, so milk, sunlight, eggs, mushrooms, pork, beef liver, ricotta cheese, sole or flounders, and usually enriched cereals. Here I went ahead and kind of put the established parameters for vitamin D supplementation. So I went ahead and highlighted the populations of interest for the next 3 studies, and it was provided by the National Institutes of Health Office of Dietary Supplements. Alrighty, so what is type 2 diabetes? So this is a chronic metabolic disorder where the body is insulin resistant. To maintain normal blood sugar levels, this condition involves the pancreas, which fails to keep up with the glucose demand in insulin production. May be reversible with early lifestyle modification. Common metabolic measures include HbA1c, insulin, triglyceride, glucose, and blood pressure. And here are some symptoms of type 2 diabetes, which include increased thirst, unexplained weight loss, increased hunger, fatigue, slow wound healing, numbness in hands and feet, blurry vision, frequent urination, and dry skin. Alrighty, and here I went ahead and showed 3 different tests to diagnose people with no diabetes, prediabetes, or diabetes type 2. So we have the hemoglobin test, the fasting blood glucose test, and the OGTT test, or the oral glucose tolerance test. So I went ahead and highlighted type 2 diabetes, so usually they have 6.5% of the hemoglobin or more, and fasting blood glucose is usually 126 milligrams per deciliter, while OGTT is usually 200 plus milligrams per deciliter. Okay, so here's the PICO question. So in adults older than 30 years old, does supplementing vitamin D 4,000 IUs per day compared to placebo lower metabolic risk factors of type 2 diabetes like HbA1c, glucose, or triglycerides? Alrighty, so here is a TRAP chart. So addressing timeliness, relevance, authority, accuracy, and purpose. So the first article by Angeletti et al. 2018 was published in 2018. And it's relevant for vitamin D use in diabetes type 2. People with type 2 diabetes and vitamin D on glycemic control was the relevance, and the authority is published in Journal of Endocrine Society, a peer-reviewed journal. The accuracy is a double-blind randomized placebo-controlled clinical trial, and the purpose is to determine metabolic benefits of vitamin D in type 2 diabetes. The next article, Pittis et al., was published in 2019, one of the largest trials for diabetes prevention, and it addresses prevention of type 2 diabetes, published in the New England Journal of Medicine, a peer-reviewed journal. And it was also a randomized double-blind placebo-controlled clinical trial, and the purpose was to evaluate preventative measures of type 2 diabetes. And the last article was Omidian et al. At 2019, so that's when it was published, and it has clinical relevance because it focuses on vitamin D and depression with type 2 diabetes. It was published in Diabetes and Metabolic Syndrome, a peer-reviewed journal source, and the accuracy is that it is a randomized placebo-controlled double-blind clinical trial. And so the purpose was to evaluate mental health effects of vitamin D in type 2 diabetes. Alrighty, so here is the article Vitamin D Supplementation in Patients with Type 2 Diabetes, the vitamin D for established type 2 diabetes, the DDM2 study, and it was done by Angeletti. Here are the results of the study by Angeletti 2018. The purpose was to determine if vitamin D improves beta cell function and glycemic control in type 2 diabetes patients. It was a randomized double-blind placebo-controlled trial. It had 127 adults with controlled type 2 diabetes or used metformin. The outcome measures included C-peptide insulin secretion rate, HbA1c, insulin sensitivity. The interventions were 4,000 IUs of vitamin D supplementation for 48 weeks versus placebo. The results showed no significant changes in insulin secretion rate or HbA1c. Strengths of this was that it was a credible study from the randomization, it used high-dose vitamin D, and it was a long duration, and it had good adherence and retention. Limitations can include many participants had well vitamin D baseline due to some of them being on metformin, and the bias could include the funding source from the USDA Agriculture Research Service. Here is the next article. It was vitamin D supplementation and prevention of type 2 diabetes by Pettis. Going over the results of this study, so Pettis et al. Was 2019. The purpose was to test vitamin D supplementation and prevention of prediabetes to type 2 diabetes. The study was a randomized double-blind placebo-controlled trial. It had 2,423 adults with prediabetes, and the mean was BMI of 32 kilograms per meter square. The outcomes included fasting plasma glucose, 2-hour post-load plasma glucose, glycated hemoglobin, and serum vitamin D levels. The interventions include 4,000 IUs per day for 2.5 years versus placebo. The results showed no significant reduction of diabetes occurring. And so the strengths of this study include that it's a credible study from the randomization, uses high-dose vitamin D, included pre-diabetic criteria, and many measurements were taken, long steady duration. Limitations include no statistical significance, sufficient baseline vitamin D levels at baseline, long follow-up period of 2.5 years, which may reveal later harm, and it included people with vitamin D deficiency, which may not show benefits in type 2 diabetes reduction. Bias could be from the funding source, American Diabetes Association, to Tufts Medical Center. So this next article is the effects of vitamin D supplementation on depressive symptoms in type 2 diabetes mellitus patients, randomized placebo-controlled double-blind clinical trial by Omedian. Alrighty, so here's the last study. It was Omedian et al. In 2019. The purpose was to evaluate vitamin D on depressive symptoms in patients with type 2 diabetes. It was a randomized double-blind placebo-controlled trial. It had 68 adults with type 2 diabetes and mild to moderate depression. They used the Beck Depression Score to calculate the average scores of the patients. It also looked at HbA1c, insulin, triglyceride, HDL, LDL, serum, vitamin D levels. In the intervention was vitamin D at 4,000 IUs per day for 12 days versus placebo. The results showed depression decreased in the experimental group and improved HbA1c, insulin, and triglyceride levels. So the strengths of this include the homogeneity of the population. It was a small number, double-blind, placebo-controlled randomized study, and it was valid depression and serum measurements. Limitations include small sample, not generalizable to the public. Short duration results may not help with severely depressed people. And some bias could be subjective bias from self-reporting, the depression scores, and the funding source of Tehran University of Medical Sciences and Health Service. Alrighty, so here's the conclusion. So we can say that vitamin D supplementation of 4,000 IUs per day can help improve depression symptoms in patients. Vitamin D does not have consistent metabolic effects on preventing or reducing type 2 diabetes. Some metabolic markers, such as deficiency in vitamin D, are improved, but no direct correlation between insulin sensitivity, lipid levels, hemoglobin, or glucose control. And supplementing patients at 4,000 IUs is safe and tolerable. So to answer the PICO question, which was in adults older than 30 years old, does supplementing vitamin D at 4,000 IUs per day compared to placebo lower metabolic risk factors of type 2 diabetes like HbA1c, glucose, or triglyceride levels? So in specific subgroups such as vitamin D deficient patients or depression, or those that have early stage metabolic dysfunction, there may be modest improvements in some of the markers like triglycerides and glucose and insulin levels. But with the studies that I presented, the results indicate vitamin D alone will not impact people with type 2 diabetes or prevent it. Future research might indicate that individuals with vitamin D deficiency and glycemic control may experience benefits, or those with vitamin D supplementation can enhance the effectiveness in metformin or some other insulin prescription. Okay, so here's the clinical application. Patients should screen for vitamin D deficiency. They should consider checking glycemic control, diabetes or depression. Check other medications that the patient is on to not cause a counter-interaction. Continue to educate the patient on diet, exercise, blood sugar control, and mental health. And it's important to co-manage with patient's primary care physician to track HbA1c, fasting glucose, and lipid profile through serum testing. And here's a picture of what a glucose tester looks like. Here are the citations of the papers, and here are the image credits. Thank you.